Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's April 2025 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is an original article entitled Prescribing Patterns of SGLT2 Inhibitors and GLP-1 agonists in patients with type 2 diabetes at cardiology, endocrinology, and primary care visits. It is authored by Dr. Dave Dixon from Virginia Commonwealth University School of Pharmacy and colleagues from Virginia Commonwealth University in Richmond, Virginia. Increasing in prevalence and incidence both nationally and globally, type 2 diabetes predisposes to cardiovascular and kidney diseases, among other complications. Novel therapies introduced for glycemic control in type 2 diabetes include sodium glucose cotransporter 2 inhibitors, SGLT2 inhibitors, and glucagon-like peptide 1 receptor agonists, GLP-1 receptor agonists. A remarkable aspect of both classes of glucose-lowering agents is that they were discovered to protect against cardiovascular and kidney diseases, independent of glycemic control. In the present study of Dixon et al., the prescribing rates of SGLT2 inhibitors and GLP-1 receptor agonists were determined at cardiology, endocrinology, and primary care visits. Their cross-sectional analysis was based on electronic health record data from outpatient clinics in a community health system that served the state of Virginia and covered calendar years from 2019 to 2021. The study examined patients with type 2 diabetes with atherosclerotic cardiovascular disease, heart failure, or chronic kidney disease, patients with type 1 diabetes, chronic kidney disease, stages 4 and 5, end-stage kidney disease, pregnancy, and patients receiving palliative care were excluded. The population analyzed included some 22,000 patients with a mean age of 68 years, 50% being female, 41% black, and 75% Medicare beneficiaries. Atherosclerotic cardiovascular disease, chronic kidney disease, and heart failure were present in some 80%, 24%, and 27% of patients respectively. Remarkably, prescriptions for either class of drugs were provided in little more than 17% of eligible patients, with visits in cardiology clinics having the lowest prescribing rates and for each subgroup compared with endocrinology and primary care visits. Prescribing rates were lower in women, older adults, Medicare and Medicaid beneficiaries, and the uninsured. In discussing their findings, Dixon et al. Addressed such considerations as lower prescribing rates in women versus men, possibly reflecting the higher incidence of genitourinary symptoms in the former, in blacks, as observed in other studies but not theirs, in drug cost, and in therapeutic inertia. While hardly envisioned when initially introduced as glucose-lowering agents, SGLT2 inhibitors and GLP-1 receptor agonists subsequently proved effective in reducing the severity of atherosclerotic cardiovascular disease, heart failure, and chronic kidney disease, and largely independent of glycemic control. The findings of Dixon et al. Underscore the need to delineate barriers that lead to the underutilization of these novel agents and to adopt strategies that promote more widespread and appropriate use of these glucose-lowering agents, which fortuitously and by their pleiotropy also lessen the severity of several of the major complications of type 2 diabetes. Our first highlight article this month is a special article entitled Advanced Insulin Injection Technique and Education with Fitter Forward Expert Recommendations. It is authored by Dr. David Karl Nath from the Diabetes Research Institute, Mills Peninsula Medical Center in San Mateo, California, and colleagues from numerous national and international institutions. In the United States, there are somewhat less than 40 million people with diabetes, with more than 8 million requiring insulin for glycemic control. Worldwide, the number of insulin-requiring people with diabetes approaches 200 million. As improved glycemic control ameliorates in part outcomes in diabetes, it is essential that insulin-requiring people with diabetes adopt recommended evidence-based insulin injection techniques so as to ensure that insulin is appropriately and adequately delivered. Notably, as demonstrated by numerous surveys, there is suboptimal recognition and/or adherence to recommended injection techniques. In 2016, the Forum for Injection Techniques and Therapy Expert Recommendation, FITTER, published in Mayo Clinic Proceedings the best practices for insulin injection techniques. These guidelines are now updated by the Fitter Forward initiative and published in this issue of Mayo Clinic Proceedings. This initiative involved 16 diabetes specialists from 13 countries who conferred virtually on 4 occasions from 2023 to 2024. Along with these deliberations, these experts marshaled recent relevant literature and other expert opinions. This special article by Karl Nath et al. Covers 4 sections. The first section discusses the absorption of insulin from subcutaneous fat and how the appropriate needle length and technique administer insulin in subcutaneous tissue and not into muscle. The use of easily penetrating, thin, high flow rate needles to effectively administer insulin and to reduce injection pain, and the use of a pen-based design to avoid excessive force during injection. The second section discusses insulin storage and handling, selection, preparation, and injection site rotation, injection techniques for insulin pens and syringes, and post-injection practices. The third section discusses the implementation of proactive risk reduction and detection of lipodystrophy, especially lipohypertrophy. The final section discusses the role of the healthcare provider in educating and advising people with diabetes and also delineates the components of evidence-based educational approaches. Insulin was discovered in 1921 and the first insulin syringe introduced in 1924. In the ensuing century, there was steady progress in multiple aspects of subcutaneous insulin delivery. The desired culmination of all such advances is improved outcomes in and welfare of people with diabetes, an objective dependent, at least in part, on improved glycemic control. Essential for glycemic control in insulin-dependent people with diabetes is the optimal delivery of insulin. In this regard, this important and timely Fitter Forward-based article by Karl Nath et al. Synthesizes and conveys current and essential recommendations regarding optimal insulin injection techniques and educational strategies for people living with diabetes. Our second highlight this month is a review article entitled Diagnostic Approach to Abnormal Alkaline Phosphatase Value. It is authored by Dr. Salvatore Minnesota and colleagues from Sapienza University of Rome, in Rome, Italy, and from Linköping University in Linköping, Sweden. Alkaline phosphatase is a biomarker of high diagnostic utility in both hospitalized and ambulatory patients. Alkaline phosphatase activity exists in 4 isozymes, with the bulk of circulating alkaline phosphatase activity originating in equal measure from bone and liver. Bone alkaline phosphatase is largely derived from osteoblasts, whereby its phosphatase activity under alkaline conditions, it removes phosphate from inorganic pyrophosphate, a potent inhibitor of bone mineralization. This action of alkaline phosphatase vitiates such inhibitory effects on bone mineralization. Liver alkaline phosphatase is derived largely from hepatocytes lining bile canaliculi and biliary epithelial cells, and a major function of the enzyme is excretion of bile. Liver alkaline phosphatase is elevated by intrahepatic and extrahepatic biliary obstruction and liver disease. The present review by Minnesota et al. Addresses these and relevant consideration, but goes way beyond to comprehensively and cohesively synthesize salient scientific and clinical knowledge regarding alkaline phosphatase, the latter discovered more than a century ago. The author's review is based on a search of PubMed from its very beginning to July 2024. The authors discuss the origins of alkaline phosphatase and its measurement, with specific sections examining alkaline phosphatase expression and structure, the analysis of alkaline phosphatase isozymes and isoforms, and the functions of alkaline phosphatase, the latter including such diverse roles as aspects of brain development and hepatic removal of lipopolysaccharide. The authors review the differential diagnoses of increased and decreased serum alkaline phosphatase levels that may arise either from skeletal or gastrointestinal causes. They also review how physiologic conditions and lifestyle choices may alter serum alkaline phosphatase level. Importantly, the authors provide very helpful diagnostic algorithms that guide the evaluation of persistently elevated or decreased serum levels of alkaline phosphatase. Finally, the authors point to a number of conditions where alkaline phosphatase may have therapeutic utility, including, for example, the use of human recombinant tissue nonspecific alkaline phosphatase in patients with hypophosphatasia. Alkaline phosphatase is a ubiquitous enzyme, and the understanding of its functions and how serum levels may be altered in physiologic conditions and disease states continue to evolve. Minnesota et al. Are to be commended for providing this comprehensive review that is broadly relevant to general medicine and its subspecialties. You can access these highlights and editor's choice articles free of charge during the entire month of April. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in News from the Editor carousel at our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links in the gray bar at the top of the home page from the Connect menu to follow us on Facebook, X, formerly known as Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. We also invite you to check out our Pioneers and Legends in Medicine video series. In addition, our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website at the homepage as well as through iTunes. As always, We greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.